Your 5-year-old girl client needs to get an influenza this morning. After discussion with her, and she understood that it will be a needle today, not a fruit-flavored juice or pill. What is the next action from the nurse? Choice number 1. Administer the injection to deltoid muscle of the patient. Choice number 2. Ask the girl to sing a song. Choice number 3. Have the parents hold their child down. Choice number 4. Tell the girl that will barely feel a thing. The correct answer of this question is number 2. Have the girl sing to relax and be more cooperative. The answer number 4 was wrong, as nurse should only tell the truth.